Hey everybody, welcome back. Today I wanted to talk about future planning for hair transplant surgery. Oftentimes we don't think about this. We come into the physician saying, hey, I got a bald spot here, fix this and let's move on with life. But oftentimes things change, especially over time. And that's the great unknown, and that's why it's important to discuss what do we do today, tomorrow, and down the road. And so another video I had prior discussed total graft availability for your lifetime. So that's an important number to know. How many grafts do you have in your donor bank for use for the future? Because you need to know how much you have in order to know if you can complete the job you want to do now, and also if you lose more hair over time, you'll have enough to do that as well. And so when I see my patients in the office, I discuss a couple things. First off, I'll talk about their family history of hair loss, their parents, grandparents with hair loss, their age, the amount of hair loss they have now, and whether they're on medications or not. So preventative medications are very helpful. They help to maintain the hair you have, help to maybe even improve a little bit of that hair. Because if you could keep as much hair as possible, it's not a moving target. If we have a moving target, it's harder to plan out for the future. So medications are number one. Do whatever you can to stop and slow down as much hair loss as possible. The second thing is to determine how much hair you want to transplant right now. And so that'll be the first step. Now let me give you an example. Say you have 7,000 total grafts available for use. And this first surgery is going to require 2,000 grafts. Now you'll have at least 5,000 left in the future, which is great. But now you have to remember where that will all go in the future. So if you lost all the rest of your hair in subsequent years, 5,000 is not going to cover the whole head. So it's important, again, medications, as I mentioned to you before, to maintain that. But also understanding, if you do lose more hair, could we possibly go in the middle a little bit, maybe in the front again a little bit, and kind of keep those things in mind. So it's always good to have a worst case scenario. I know we don't like to think about the worst case scenario, but sometimes it's important, especially if you want to sleep at night, knowing and rest assured that you've done enough and everything you can for your hair loss concerns. And so worst case scenario, you lose everything. I want you to be comfortable with maintaining maybe the front half or front 3/4 of your scalp, and maybe the back will be bald. But at least you'd have a very nice frontal result from the curbside appeal, we like to say sometimes. And so those types of future thinking are very important. So when you discuss with your hair transplant surgeon about these things, you want to think about today, 5 years down the road, and maybe 20 years down the road as well, how many grafts you have now, and what you could potentially do along the way. And so I think if you have that mindset at the onset, I think you will be better prepared for the future as well. So I hope this has helped a little bit. Take care.